which of the following substances is most likely to accumulate in this patient's liver? A 3-year-old girl was brought to the pediatrician by her parents due to recurrent episodes of vomiting and lethargy after consuming sweetened beverages and candy. Parents report no other health concerns, and girls otherwise well nourished, growing normally. Lab tests reveal increased anion gap, mild hypoglycemia, and elevated liver enzymes. Okay, so it sounds like to me it's type 1 diabetes with like a maybe she's having like a ketoacidosis here for the increased anion gap. That would also, I think that would help explain the hypoglycemic um, issue. Let's see, which functions mostly accumulate in the liver? Okay. Hmm. Maybe it's not type 1 diabetes. Let's see. Well, I think the mechanism is that you can't there isn't the pancreas isn't making enough insulin so that glucose cannot enter the cell or liver cell here. Let's see, which one is most likely to accumulate in the liver? Oh, the liver is going to store a lot of glucose.
So let's say you think, okay, so you think the diagnosis is diabetes type 1, correct?
I think so.
Okay, if it's diabetes type 1, are you going to have a lot of sugar or not that much sugar in your bloodstream? People
You're
with diabetes.
going to have, I thought you would have a lot because
Yeah.
you're not making insulin. So then that
Yeah.
does explain the hypoglycemic
So,
episode.
yeah, so this is says mom.
So it's more of like a oh, it's like a metabolism question then.
Exactly. Okay,
Okay.
so that's the thing. So I'm good. I'm happy that you're like thinking about the diagnosis. I like that. But you have to
Okay.
look at, remember all diabetic patients will have, even when they go into ketoacidosis, they're going to have like 400, 500, right? Glucose, right? Which is super, super high hypoglycemia with ketoacidosis, right? But here, the kid has, hypoglycemia, meaning that some kind
Hmm.
of metabolism is an issue, right?
Yeah, it seems like okay, with sweetened beverages or candies, you can't digest them. I'm trying to think of what's the most common here. It doesn't say like a particular food. Um, so what's going to accumulate? It's got to be somewhere in the pathway that's just not functioning. So that there's like a it's like a backlog. But sugar is getting into the cell. Um, I know G6PD deficiency is a thing. Um, if it said fruit, although we go through fructose 1,6, and then you have one phosphate and then 1,6. Hmm, I don't remember those too well.
That's okay. So I would say pick your gut answer choice and let's go
I would
through
just,
it.
yeah, I would go with glucose 6 phosphate. I'm really not sure.
Sure.
Um,
Okay, let's work through this together here.
okay.
Okay,
So,
symptoms of recurrent vomiting, lethargy after sweetened beverage and candies, and then increased anti-gap, mild hypoglycemia, elevated liver
okay.
enzymes is usually deficient in allulose B. Okay,
Okay.
which is fructose metabolism. Just remember, all sweetened candies doesn't necessarily mean it's like just glucose, right?
Okay.
It's mostly fructose syrup now, right?
Okay.
So accumulation of F1 phosphate in the liver causing hereditary fructose intolerance, right? Fructose 6 is not associated with kind of patient symptom.
Okay.
Galactosemia, right? Deficient in galactose 1 phosphate,
Okay.
urotransferase, jaundice, hepatomegaly, cataracts, right? Because that
Mhm.
deals with cataracts. Glucose 6 phosphate. Remember, this is von Gert's disease,
Oh, it's a,
right?
okay.
So
Glycogen storage. Okay.
yep, lactic acidosis, hyperuremic, and hepatosplenomegaly,
Okay.
sorbitol, sugar alcohol that can accumulate in uncontrolled diabetes mellitus due to increased allulose reduction. So glucose is sorbitol. Yeah,
Okay.
so biochem question. So
Okay.
sometimes one of these questions, I'm just saying as you're learning, right? I to be honest with you, I've tutored for a long time and sometimes I can't remember these pathways too. So you have to kind of be like, okay, so I know it's a biochem thing. Let me remember
Mm-hmm.
the best I can, pick an answer choice, and then kind of learn from it because
Okay.
sometimes these questions are more like, especially the basic science ones, right, which is biochem. You can't there's not a lot to think through, it's like kind
No,
of,
it's either you kind of know it or you don't,
yeah,
right?
and if you don't know it, then it's like, okay, let me use that brain power for another question, and that's like a test
Okay.
taking too.
Okay.